Hello, I'm Dr. Jerry Mixon from Longevity Medical Clinic, and I'm here today to talk to you about menopause. Now, menopause is a problem that is grossly underestimated. Most people think of it as, well, you haven't had a period for at least a year, and you may be getting some hot flashes or some mood swings, but if that's all you have to worry about, it's not a big deal. Your doctor may give you a little bit of estrogen for a few months, and if your hot flashes go away, everything's considered to be just fine. That's wrong. Menopause, stopping your periods, is a sign that something is seriously amiss in your body. Now, if your goal as you get older is to get slow, fat, weak, dumb, and sexless, fine. You don't need to do anything else because that's what's happening to you. That is, quote, normal aging. But menopause is a sign that your estrogen is down about 50%. Your progesterone is down about 2/3. Your thyroid's down about 25%. Your dehydroepiandrosterone and pregnenolone are almost down to 75, 80% lower. Your testosterone is down about 80 to 85% below your peak values. Your bones are thinning out. Your brain is slowing down. You're gaining weight. Your metabolism is slowing. Your risk of breast cancer is rapidly rising. Your risk of all cancers, in fact, is going up. As your body weight is increasing, your risk of diabetes, strokes, heart attacks, degenerative joint disease, etc., are all accelerating at ever increasing rate. Does that sound good to you? No, of course not. So let's take a look at what menopause really is, what's really causing it, and then in a second video, we're going to talk about how to fix it. First, I said your thyroid is down. It is 25% or so for most women, and that means their metabolism is slowing. They're finding that their energy level is flagging. They're getting more tired earlier in the day. Their brain is not quite as fast. They're walking in a room saying, what am I doing in this room? Why did I come in here? They're those senior moments. Your metabolism is slowed to the point that the same diet that kept you lean and fit in your youth is now making you fat and roly-poly, and that's not what you want at all. So thyroid decline is in fact part of menopause. The second thing that's happening to you, your estrogen level is down, but it's not to zero. In fact, you're still making at least 50% of the estrogen you made at 18 or 20. Your estrogen level is not why your period stopped, but that decline in estrogen means that your skin is looking a lot older. You're getting those fine lines and creases. Your skin's starting to get dull. You're having to use more makeup to make your eyes look brighter and your skin more cheerful because the lack of estrogen is just diminishing that youthful glow you used to have. Your bones are starting to thin out. Estrogen inhibits bone loss, and as estrogen goes down, your bones are starting to dissolve faster. Your brain is changing in that your verbal skills are strongly dependent on estrogen. And so as that declines, you're starting to have more trouble finding the appropriate words that you're wanting to express yourself. The other issue is that your testosterone is down. Now, here's something most women don't understand. They think estrogen is the primary female hormone, and it is not. At your peak, when you were 18 or 20 years old, as female as you were ever going to be, you had 2.5 to 3 times more testosterone in your bloodstream than you had estrogen. Your estrogen level was peaking at about 25 to 35 nanograms per deciliter, and your testosterone was 70 to 80 nanograms per deciliter in your bloodstream. That testosterone drop of 80% or more is resulting in your sex drive fading away. 70% of women by around age 50 are losing interest in sex. And if their husband hasn't lost interest, because even at 50, his testosterone is about 200 to 250, hers is running around, 8 or 10, that's a big difference, all right? Also, the testosterone stimulates new bone growth. So the combination of low testosterone, so you're not making new bone as fast, and the low estrogen, so you're dissolving bone faster. That's why you're developing osteopenia and osteoporosis. You're getting fractures when you shouldn't have to have fractures. The testosterone is also important for drive, ambition, self-confidence, and stress tolerance. As your testosterone levels are dropping, you're getting more diffident, less able to handle stresses and anxiety in your life. You start to worry more. Your energy is again flagging because the testosterone is helping your muscles to be strong and give you endurance, and without them, well, you get weak, you get tired, you want to sit more. Strong muscles don't get tired. Weak muscles are tired all the time, and that's a big part of your testosterone load. Pregnenolone is an adrenal steroid that is also involved in sleep, in rest, in verbal ability, and in stress tolerance. So that, in conjunction with the low testosterone and the low progesterone, is aggravating your sleep and your stress issues. Dihydroepiandrosterone is another adrenal steroid. It is also critically important for being awake and alert and active and cheerful and ambitious in life. There are 6 hormones we've just addressed, and all 6 of those hormones are declining, and every one of those hormones is important to your youth, your vigor, your well-being, and your happiness. Let me touch on one other. Testosterone and estradiol are incredibly important in avoiding breast cancer. The lower your estrogen levels and the lower your testosterone levels, the higher your risk of breast cancer. As your estrogen and testosterone are dropping, every year your breast cancer risk is rising. When we give women back testosterone along with their estrogen, we drop their risk of breast cancer by 2/3. The standard in the United States is for women who get no hormones of any kind. There's about 300 breast cancers per 100,000 woman years. Women that get adequate testosterone and estradiol get 111 breast cancers per 100,000 woman years. 300 breast cancers versus 111 breast cancers. Which group would you rather be in? My wife, she's chosen to stay in the low-risk group. So much for menopause. It's more complex than you thought. Giving you just estrogen is not going to fix the problem, and certainly not giving you herbs and botanicals is not going to fix the problem. There are 6 hormones we have to address to treat this problem correctly. Watch the next video from Longevity Medical Clinic, and you will see exactly what should be done. Thank you for watching.